Hi everyone, my name is Alaina, my pronouns are she, her, and today I'm going to be talking about my experiences with PCOS. So I was diagnosed when I was around 14 to 15 years old. I had symptoms with my periods at first, so definitely getting my periods every 2 to 3 months for a 5-day cycle. My cycles were really bad as they were really heavy and cramping and aching, but it gradually got worse with having it every 4 to 5 months, and it got so bad it was every 6 months. That was actually before I got diagnosed, but during my diagnosis stage, I was growing excess body hair. So because I am South Asian, my body hair is a lot more than usual, which I got used to at that age. But I started growing hair around my chin and my chest that was a lot coarser and thicker than usual. At that point, I knew that wasn't my typical body and how that they would react. So I saw a specialist about it, did some blood tests, did some ultrasounds, and it came back with something being up with my ovaries. But because I was so young, they didn't want to diagnose me. But a few years later, I've been diagnosed with it. So my symptoms now that I'm dealing with would be my fluctuating mood, body weight, and appetite. So they all go up and down every single day. Some days I'm eating, some days I'm not. I lose 5 kilos, gain back 5 kilos, and just a lot of mood swings throughout the day. I would say that has to do with my hormones. So definitely I do have a lot more testosterone than estrogen. The way I deal with a lot of medical stuff is through my doctors and gynecologists. And for my mental and emotional stuff is a lot of self-care. So personally, I like to do more of routines, so morning and evening routines with skincare and journaling. A lot more games, like in my opinion, to help distract myself, especially working a lot. Another thing I'd added would be a lot more self-care and self-love, showing myself more kindness every day, as it has been a tough few years dealing with this emotionally and trying to come to terms that there isn't really a cure with PCOS. It's more of how to handle it. So my advice for everyone who's dealing with it, especially young people, is to definitely give yourself a lot more kindness and give your body a lot more love, because if you give your body a lot more love, it becomes a lot more easier to handle stress and being overwhelmed, because your body deserves a lot of love and kindness every single day. So yeah, thank you so much.
Hello everyone, my name is Vaish and I go by she, her pronouns, and I'm here to chat about my lived experience with polycystic ovarian syndrome, or PCOS. PCOS is when there are several small cysts in the ovaries as well as abnormal hormone levels in the blood, causing irregularities in ovulation. I was diagnosed with PCOS when I was 16, and that was because ever since I was menstruating, everyone around me, including people in my family, were having a period once every 4 weeks, but I was having a period once every 4 months, and sometimes my periods will last for about 3 weeks straight. Because of this, it is difficult to predict when my periods are coming, how my body would react to it, and what my fertility is like. A significant turning point for me was when I was 18 and I had gained 11 kgs of weight over 5 months, and I was having difficulties concentrating in school and extremely low moods. When I had gone to my gynecologist, I was prescribed the oral contraceptive pill to help regulate my hormones, metformin, which was diabetes medication to help with my insulin resistance and my metabolism, spironolactone because the high testosterone in my body was causing a lot of facial hair and chest hair growth for me, minoxidil because I was losing hair on my head, antidepressants and ADHD medications to help me at school. While this was okay in the interim, I never reacted well with the oral contraceptive pill. In the past 6 years, I've tried 5 different pills on and off, and I've gone to the ED for about 4 of those pills due to blood clots and heavy bleeding that came with it. PCOS affects 10% of women around us, and between everyone it manifests extremely differently. For me, it looks like chronic fatigue, facial hair growth, difficulties maintaining my weight. But for others, it means infertility and subfertility, where I've heard of people who have tried to conceive for about 6 years and had difficulties doing so. And for others, it might be difficulties losing weight and even diabetes. Most people misconstrue PCOS as just heavy periods and painful periods, but it's a lot more than that. And there needs to be a lot more awareness on what PCOS entails and how to support our mothers, our sisters, our partners, our friends, our colleagues with PCOS to achieve better outcomes in life. I manage my PCOS through a combination of cardio and HIIT workouts, avoiding carbohydrates, stop eating by 8 p.m., following a hormone drink recipe I found on Instagram, some Western medications, and a lot more. PCOS is a complex disease and a lot of people overlook it.